You know, it's normal sometimes to chalk up maybe ear pain or a sore throat to cold, maybe even the flu or allergies, especially this time of year. But if it lasts for a long time, you might want to ask a doctor about something else. And it's a subject that's not easy to talk about: head and neck cancers. And the ways to catch it in time are all up to you. We're joined by Rick Deal. He's a head and neck oncology navigator at Cone Health Cancer Center at Wesley Long Hospital. That is a conversation that is so hard for people to say, you know, Doc, are you sure it's a cold? Are you sure it's just a sore throat?
Right. Nobody likes to hear the cancer word, but we're finding that about 4% of the cancers diagnosed each year are head and neck cancers, and that translates to about 65,000 new cases each year.
Wow.
As with all cancers, early detection is key to treatment and prognosis. So if you're having symptoms such as chronic sore throat, difficult and painful swallowing, changes in your voice, or you detect swellings or lumps in your neck, it's really important to get a hold of your primary care physician to have an appointment and get checked out.
So, you know, a lot of times though we say, oh, this is just something, it'll go away, you know, maybe it's just a little virus, my lymph nodes are swollen or something like that. How long should we wait, and when should we say, let's go get it checked?
That's true. These symptoms can be characteristic of other illnesses as well, but if they persist for 2 to 3 weeks, very important to get with a doctor, and they can make a referral to an ear, nose, and throat specialist for further evaluation.
You know, are there causes of head and neck cancer?
Yes, very much so. I'd say the primary causes are tobacco usage, including the smokeless varieties, heavy alcohol use, and now we're seeing in the folks who do not smoke, we're seeing the prevalence of the human papillomavirus in their diagnosis. HPV is a sexually transmitted virus. There's a lot of research underway right now to better understand the association with head and neck cancers. Having said that, because there's an increased incidence of head and neck cancers associated with HPV, it's recommended that preteens, children, boys and girls 11 and 12 years of age, receive the HPV vaccine so that they can develop immunity before they're exposed later in life.
Let's talk about treatment once someone is diagnosed.
Sure. Well, the treatment depends on several factors. One, where the cancer is located, the extent to which it's grown, in other words, the staging, has it spread, and then also the age and the overall health of the individual. So with that information, then the team can choose the best treatment. That can include surgery, which is intended to remove the cancer and any affected tissues. There's radiotherapy, which is really the cornerstone of head and neck cancer treatment, in conjunction with chemotherapy. Chemotherapy can provide an additional 10 to 15% benefit in conjunction with radiation. But it can be any combination of those three, but that's up to, again, the diagnosis.
And are the recovery rates pretty good? I mean, if it's caught early?
Yeah, well, as with all cancers, recoveries are good. Head and neck cancers have some of the best curable rates. Awesome. But again, it's really important to be proactive in your health care. Get in touch with your primary care doctor if you're concerned about a symptom. You know,
you can tell Rick is very, very versed in this as a navigator there at Cone Health Cancer Center. And he's going to be the keynote speaker at a couple of seminars coming up for Cone Health's Cancer Education Series. The topic, radiotherapy for the treatment of head and neck cancers. You can go on Friday, April 12th, from noon to 1 at the Cone Health Cancer Center at Alamance Regional. Now, if you can't make that one, there's another one on Monday, April 29th from 6 to 7 p.m. at Wesley Long Hospital. You can also register online at conehealth.com/classes, or you can call 336-832-8000. And if you'd like more information on different types of cancers, the treatments and support services, you can go to conehealth.com/cancer.
House Call on Fox 8 is sponsored by Cone Health.